Electrocution is one type of dangerous accident that requires emergency assistance. These accidents generally occur in adults at work and children at home. Electric current flowing in the body can burn tissue, causing organ damage. When the current is large enough, electric shock can result in death. Find out the causes and methods of first aid when electrocuted in the following review. Causes of electric shock. The human body is a good conductor of electricity. When humans are electrocuted, electricity can be delivered throughout the body so that the damage that occurs can be very extensive. Often the greatest damage occurs to nerve tissue, blood vessels, and muscles because these tissues have the lowest resistance, immunity, to electric current. Some of the most common causes of electric shock are as follows: contact with power tools or wires that are not covered by insulators. Electrical strike from high-voltage power lines. Struck by lightning. Electrocuted due to flood. Contact with machines or electronic devices. Touching a power source with other metallic materials. Compared to burns in general, electric shock is more dangerous because the visible wounds on the surface often do not reflect the actual condition of the victim. The severity of organ damage due to electric shock is influenced by various factors. These factors include the length of contact with the electric current, how strong the electric current is, and distribution of electricity in the body. Shock from electric currents greater than 200,000 amperes causes a high fatality rate even though the victim's time with the electric current is short. Heart, decreased or increased blood pressure, heart muscle damage, heart rhythm disturbances, and coronary infarction. Nerves, headache, weakness, brain swelling, impaired mental status, insomnia, restlessness, seizures, coma and bone marrow disorders. Muscles, muscle death and compartment syndrome. Bones, joint dislocations and fractures. Skin, burns due to electric shock. Blood vessels, formation of blood clots, blood clotting disorders, and rupture of blood vessels. Lungs, fluid buildup in the lungs, lung muscle injury, and respiratory failure. Kidneys, electrolyte disturbances, body pH disturbances, and acute renal failure. Vision, inflammation and bleeding of the eyeball. Corneal burns, and cataracts. Hearing, inflammation of the mastoid bone, tearing of the eardrum, ringing in the ears, and hearing loss. Pregnancy, fetal death. Seeing the danger that is not trivial, first aid is needed when someone is electrocuted. First aid given when you or someone else is electrocuted can reduce these harmful effects. Launching the U.S. National Library of Medicine, the following is a safe treatment when electrocuted. When you see someone else being electrocuted, be sure not to touch them directly. The most appropriate first aid when electrocuted is to cut off the electricity that struck the victim's body. If the situation is quite safe and supportive, you can turn off the fuse or electrical panel that is the source of electric shock. When electrocuted, it is difficult for you to perform first aid on yourself. However, try as much as possible to stay away from electric currents. If you have trouble turning off the power source, try to keep the victim's body away from electricity. Remember, avoid touching the victim directly with your bare hands. You can use objects that do not conduct electricity around you, such as carpets, broom, table, chair, stick or any object made of wood, paper and rubber. When pulling or pushing the victim's body, avoid using materials made of wet objects or After successfully releasing the victim from the electric shock, immediately check the victim's condition, especially breathing and pulse. You need to call the emergency telephone number, 118, for emergency medical assistance in the following cases. High electric shock. The victim has difficulty breathing, the victim's heart rate increases, The victim has seizures, burns in various parts of the body, the victim vomits, and is unconscious or faints. Make sure you clearly describe the electric shock accident that occurred. If possible, find out how strong the current is. If you are electrocuted yourself, if you can afford it, scream for help after you escape the electric shock. Ask someone else to call an ambulance if you are sick or have other serious problems. While waiting for medical help to arrive, stay with the victim. Try to check the condition of the victim's body to see if there are burns and injuries. Also be prepared to do first aid for broken bones. If the victim shows signs of shock such as weakness, nausea, rapid breathing, and a pale face, immediately show the victim's body with the legs raised above the head. If the victim loses consciousness, immediately check for breathing and pulse. When breathing or you cannot feel the victim's breath, perform cardiopulmonary resuscitation or CPR and give artificial respiration. Also make sure the victim's body clothes are on top of the blanket or if the victim's body temperature drops. The following is a video of a person who was electrocuted very badly in Indonesia. The following video we took from the TikTok application.